Hi, everyone. Emily and I are going to be talking to you today about Noonan syndrome. So a brief definition of Noonan syndrome is that it is a common genetic disorder associated with atypical development and congenital abnormalities. Some of the most common symptoms of Noonan syndrome is facial dysmorphology, short stature, and cardiac abnormalities. And in our next slide, we have a picture here to give you a visual of what an individual with Noonan syndrome typically looks like. So you can see the webbed neck here, as well as the forehead and the slanted eyes. So this is just to give you an idea of what these individuals can present with. When we look at the etiology for Noonan syndrome, like I stated before, it's based off of genetics. So it is based on an autosomal dominant genetic mutation. There are 12 possible mutations that an individual with Noonan syndrome can have. However, the most common type is PTPN11. This is identified in about 50% of individuals that have been diagnosed with Noonan syndrome. When we look at the prevalence and prognosis, Noonan syndrome occurs in about 1 in 1,000 to 2,500 live births. However, this number, it can change, mainly because some individuals with a milder case of Noonan syndrome often aren't actually diagnosed with the condition, so those are often left unaccounted for. When we look at the prognosis, some mutations typically do cause a severe or long-term symptoms like the heart defects that I've talked about, and they do vary depending on the clinical presentation and complications. However, the cardiac prevalence in most individuals is typically high, with about 50 to 80% of Noonan syndrome cases having some sort of a congenital heart disease. When we look at the medical management for Noonan syndrome, like I stated, most individuals do have some type of a cardiac deficiency. Some of these mild cases can be left untreated. However, if an individual has a moderate to severe cardiac condition, these do require surgical interventions. The most common type is a balloon vulvoplasty, and any cardiac condition in a Noonan syndrome patient is treated like a typical pediatric heart condition. When we look at the hematological factors, most individuals that have been diagnosed with Noonan syndrome do have some sort of a bleeding disorder. And this is characterized by factor deficiency and platelet defects. However, this can be treated using factor 7A. With the endocrine system, like I've stated before, some individuals have a short stature and they have delayed puberty. However, in order to combat this, most individuals are treated using growth hormone therapy. There are other areas of an individual's life and body that do need some sort of medical care. And as long as these individuals are continuously followed up, monitored with specialists, especially their primary care providers, these areas in their medical treatment can be monitored in that way.
So what is the role of occupational therapy? We kind of split it up based on the common deficits seen in individuals with Noonan syndrome. In regards to motor delays, commonly seen is hypotonia, motor planning deficits, and muscle weakness. And these delays can be approached using dynamic systems theory or the motor control motor learning theory to teach them movement, or using the biomechanical frame of reference, using things like strengthening or positioning to help combat those delays or help rehabilitate those delays. In regards to cognitive delays, commonly seen is executive functioning problems, attention deficits, and memory delays. And this can be commonly approached using the cognitive behavioral or behavioral frame of reference. So utilizing things like reinforcements or teaching clients their own strategies for self-monitoring. Some language skills that are commonly delayed is communication and emotional expression. And this would be treated in collaboration with a speech therapist. The speech therapist can cover the actual speech problems, and then the OTs can come in and play a role in social participation. And then a super important area that OTs can help with is cardiac rehabilitation. It's been found that pediatric heart conditions can negatively impact body functions and development. So this requires a holistic approach from OTs to address how those cardiac issues are impacting their functioning and their development. Occupational therapy interventions, some things that are important to keep in mind because we are working with pediatrics, they should be play-based. And that means you can use occupations as the way to develop underlying skills, or you can use it as the end goal is them engaging in age-appropriate play. Collaboration is super important. Family centeredness is so important, especially in early intervention. And then teacher and special educators, when kids become school age, whether their therapy is in the clinic or is in the school, we want to see those transfer of skills and their functioning in the classroom. And then, of course, being client centered. We want to use meaningful and motivating activities for functional outcomes. We want the kids to be actively engaged so we can get that transfer of skill and that learning to happen. So this is our case study. This is Lily. She's 33 months old and she was diagnosed with Noonan syndrome at birth. She's currently receiving early intervention occupational therapy and also speech therapy. Her support system includes her mother, her 14-year-old brother, her nanny, and she has a dog. In regards to her socioeconomic status, she receives child support from her father, and her mother is a very successful attorney, putting them into the mid to high range for SES. And then they live in a 2-story house in Montecito with a large backyard and pool, which is super great for her exploration and play. She loves animals and swimming and Paw Patrol. And she, in regards to her background, she was born with a mild ventricular septal defect, but it was so mild that no surgical intervention was necessary, just monitoring. Her gross motor, she has hypotonia in her lower extremities, which leads to a clumsy gait and W sitting. She presents with a palmar grasp and frequently drops items due to decreased fine motor strength. She is easily distracted, has frequent outbursts, and shows lots of frustration with difficult tasks. And she is receiving speech because she currently is only presenting with single word utterances. And in regards to play, she's only doing solitary play, which is not age appropriate for an almost 3-year-old. So in regards to her present level of performance, these are some functional problem statements, and all the things I've mentioned are impacting preschool activities, peer play, functional play, and self-feeding with a fork. So the 3 occupations that we'll be covering in our interventions is sensory motor play, self-feeding with a fork or utensils, and social play. And here you can see the client factors and performance skills impacted. So our first activity is a sensory motor play activity in the backyard. It's an obstacle course. And our rationale for this, we want to start off with some movement for that dopamine release to promote attention and focus for her tabletop activities because she does present with low attention. We want to incorporate play-based and motivating activities to help develop those motor skills to improve, increase opportunities for exploration, and then strengthening. The things we do in the obstacle course are actually going to help improve that low tone that we're seeing, her decreased fine motor strength, and help her with her dynamic sitting balance. Our second activity is a self-feeding activity with utensils. We're incorporating motor control and motor learning concepts in this, which includes stuff like whole task training, feedback on performance and results, demonstration of the task. And through all of these things, it's said that it can help develop improved neural pathways and help the child learn those those proper movements. And then we also use the idea of proximal stability for distal mobility. We incorporate positioning into this activity and educating the mom on positioning for tabletop activities. And this can help allow for optimal movements needed for functional tasks. And then our last activity is a social play activity. Because she is currently only doing solitary play, we want to start moving her towards more age-appropriate play, which for her would be parallel play. So our activity actually targets imitative play to introduce new skills like mimicking that's needed for parallel play, which would be more age-appropriate, which is the long-term goal we will eventually get to, but right now we're just addressing the short-term goal. And then co-regulation. Through modeling, teaching, and feedback from the mother, it can help to promote self-regulation and hopefully teach Lily skills that she can use and no longer need that modeling and teaching, but be able to use the self-regulation in other play activities. And that is it for us. Here is our references. And thank you.
Hi guys, so I'm Sabrina. I'm going to be your occupational therapy student today. So we have Lily here, and thank you, Mom, for having James today. I know Lily's a huge fan of James, so I'm really glad that we were able to incorporate James today in our session. So today we're going to work on just some strengthening exercise for Lily. And so she loves being outside, so we're going to be outside in your backyard. And since we're going to be doing some strengthening stuff, we're going to be on the grass, making sure that she has that cushion so that she's safe. So if she were to fall, she can just land safely on the grass. So when we're doing these types of exercises, Mom, we want to remember that be either outside on the grass or be inside around carpet and just having cushion around her. Okay. Sound like a plan? Yes. Any questions? Nope. Okay, let's get started. So we're going to start, I'll give you 3 options. We can do bear crawl, bunny hop, or wheelbarrow. Which one do you want to do first? Bunny hop. Bunny hops? Okay, so go stand on that side next to James. So do you know what how bunny hops? Like that? Okay, so we're going to do that all the way across. Okay, Mom, I'm going to have you stand over here so that you can be their target to reach them. And Lily and James, we're going to do bunny hops. So James, try and go slow with her, be at her pace. Lily, you're going to do hops, okay? At your speed, however fast or however slow you want. Okay, when I say go, you're going to start going, okay? Ready, set, go. Oh no, are you okay?
You want to try again?
Let's keep going. Good job.
Whenever you're ready.
Good. Okay, Mom, do you want to stand with her or do you want to come on this side?
I'll just walk with her.
Walk with her? Okay. Ready, Lily? Big jump. Go. Good. You want to keep going? Okay, a little bit more. Good job. Okay, let's start again. Go halfway. Let's just to me now, okay? But let's do little jumps. Sound good? Okay, ready, set, go. Good. You want to go back that way? Go towards Mom. Ready, set, go. Okay, you good? Great job. So now we're going to do bear crawls. Do you guys know what bear crawls are? You do, James? Okay, do you want to show Lily what a bear crawl is? Ooh, those are good bear crawls. Do you think you can do that, Lily? Okay, do you want to take your jacket off? Because it might be hard on your arms. Okay. Mom, do you want to hold it? Do you want me to hold it? Okay. Okay. So, Lily, let's just see you in the bear crawl position. Good? Okay. Now try and take your steps forward. You can do it with your. How's that? You okay? Try and open your legs a little bit, Lily. Can you? Look at how James's legs are. Okay? Was that hard? A little bit? Do you want to try it on your knees? Like if you go on your knees like this and kind of crawl a little bit? Let's try it like that first.
I'm going to stay over here.
Go on your knees. You want to crawl? Does that feel too easy or hard? Easy?
I feel like this.
You want to do it like James? Good job. High five. Okay, now do you want to race? I have some stickers. I have some JoJo stickers. Yeah? Okay, get your bear crawl. Ready? Set, go. Great job, Lily. You want a sticker? Pick out your sticker. That one? James, you want a sticker? Okay. Okay, the last thing we're going to do is wheelbarrow. So, you know what wheelbarrow is? So you're going to be like this, and your mommy's going to grab your legs. And you're going to race all the way to James, and he's going to be cheering you on, okay? And you're going to move on your hands, nice and slow. If you need a break, just tell us. We can take a break, and then we can keep going. Sound good? Sound good, Mom?
Yes.
Okay. So whenever you're ready. Ready? Yeah, kind of like a handstand.
Are you ready? Let's go.
Come on, Lily, you got it. It is like we should chip this. Good? You want a break? Okay. Do you want to take a long break? Just a little break? Okay. You ready again? So quick. Okay. Now, okay, hold on. Are you good? Keep going. Good job. So we're at the end of our session now. So, Lily, thank you for being such a good sport. High five. James, too, thank you for being with us today because I know Lily really enjoys when you're here with her and when you're helping her out. Mom, I have a few other activities that Lily can do, even with James. That way she can work on those kind of strengthening things. But I know she kind of got tired a little bit today with those things. So there's just other activities like at the park and at home that she can do to work on her strengthening. And that way you guys can all work on things together. Cousins and other people in her family, they can help out too. We want to make sure that we're incorporating everybody in the family to help her out, and we want to make sure she is having fun. So she's playing around and just doing normal things. We don't want her to think of it as always therapy. It's not fun. And then if you are going to do outside, remember to do it on the grass so she has that cushion. And if you're doing it inside, just put some pillows around her if she's doing them inside so that if she were to fall, she doesn't hurt her. All right. Sound good? Yes. Okay.
So now that we did our outside activity, we can transition into this feeding activity. And I recommend doing like an activity that requires movement like we did outside before a tabletop activity where you want them to be kind of focused and attentive, because that movement can help, release something called dopamine, which actually helps them focus. So now Lily here will be more focused for our activity. And so we're gonna do a feeding activity, and I'll do it with her, and then I'll have you practice the way kind of we demonstrate it. So we have Lily sitting in her high chair, and one of the things that's super important is that she has kind of like a really good posture. Mm-hmm. So I'm going to teach you kind of the ways that you want her to be seated. So her high chair is pretty good, and it has the footrest, which is nice for her because we want her to be at what we call 90-90-90. So her hips to be at a 90-degree angle, her knees, and then her ankles, and we can see that she has that right here. And we want their pelvis to kind of be neutral. You don't want them kind of slouched like this. It's not good. And you want their trunk to be upright. So if you notice that maybe she's not getting that stability in the high chair, a simple fix can be just like rolling up some towels rather than, buying a new seat, and kind of tucking them in to make sure that she's seated upright and that she has some good stability. And then you want to make sure that her tabletop is kind of like 2 inches or 2 fingers above where her belly button is, which it is, and I think you can adjust this on this high chair if it wasn't, and that gives her kind of, her arms are right where the food is. And then the last thing is making sure that she has a good line of vision of her food, so she can see what she's doing, which she does, and she'll look down at it. And so that's super important. Okay, so now we'll have our snack with Lily. We got some applesauce here, which is her favorite. So Lily, snack time. And so I'm going to show you how I kind of talk to her teacher, and then you can try out. Lily, snack time. Finger, thumb, pinch, scoop, scoop. Your turn. And now we'll have her try it, and we'll see how she does. So we'll observe her doing it, and then after we want to give her very specific feedback. Good, Lily. I like how you hold the spoon. Next time, no spilling. Okay. Would you like to kind of try and instructing her? So there's a spoon there actually. You can demonstrate with her.
Okay, Lily, let's do it together. Okay. Finger, thumb. Okay, good. Now scoop the applesauce. Okay. Put it in your mouth. That's it. So next time, Lily, look down at your food, not at mommy.
Yeah.
Finger, thumb, look down at your food, scoop the food, put it in your mouth.
So it was good that you gave her very specific feedback on like what she did right. That's super helpful. And you can even use less words and just simplify, because of her age. She's only 3. She's doing really good, and we'll have her keep eating her snack. And so if you find that she's not able to grasp it and she's spilling everywhere, you can do kind of where you do part of the task for her. So maybe you scoop the food, because maybe that part's hard, and then you hand it to her, and she can use that grasp, and she brings it to her mouth. Or you can either let her dip the food instead of kind of scooping, and she'll still get some on there. But if she's doing really well, then you could try it with other foods that maybe are more difficult to scoop. Like peas are hard because you have to really it's not liquid, and that could kind of challenge her a little bit. But yeah, I definitely recommend that you kind of sit with her during meal times and work on these things. Maybe one meal a day or something. And I know you have a nanny too. Maybe we can teach her this stuff too. Do you think that would be possible?
I mean, is it not good for her could she try and grasp it?
For like peas, yeah, that would be something that we could work on too, and we could teach her to try to, again, that requires kind of like a more fine grasp.
Like peas, and she likes put up banana.
Okay, yeah, so we could even try using, as she gets good with the spoon, the next thing we would try was a fork, and she could use the fork maybe to try to pick up bananas and stab them, and that could be something we could try to work on that grasp with as well. But if maybe utensils are too difficult, we can also work on doing like more of a pincer grasp for smaller foods. But something with applesauce, you need a spoon to do, and then it's safe. You don't have to feed her, because at this age she should be feeding herself with a spoon and a fork. So we just have to keep working on that grasp.
Hi, Lily. Hi, Mom. Thanks for being with us today. So I know we've already today worked on a few other things. So today, if you guys want, we can take a walk to the park. You can take us with you. Feel free to start walking to the park whenever you want. Are you guys ready?
Okay, let's go.
Let's take a walk to the park. Okay, Mom, I just want to kind of talk with you a little bit. So the last time we spoke, we kind of got a little bit of an idea of Lily's things, her favorite things. We know she likes animals and swimming, but we've never really talked about her time at the park. So maybe just kind of let Emily and I know, like, what Lily enjoys at the park, what she doesn't enjoy.
We
Maybe
go to the park to struggle. She will not. She refuses to get off the stroller. I try and she throws a fit. It's really impossible to get off the stroller. She does not like it at all. So I'm struggling on her getting off and wanting to go play with others. And that's pretty much where we're at right now.
Okay, well, maybe today, since we are at the park now, maybe we can show you a few ways for you to maybe start with the playing part. A good thing to do, even just at home, not just at the park, is for you to start playing with her stuffed animals or any other dolls that she has, and inviting Lily to come play with you. So if you start playing, do you have any toys with you at the park right now?
Yes, I actually brought her favorite ones.
Oh, perfect.
Some of her animals that she loves to play with.
I love it. I love it. So maybe with like the doll, you can start like playing with the doll. You can maybe use your imagination. Since she's wearing like a Dodger cheerleader uniform, maybe say like, oh, she's cheering for Lily to play today. She wants Lily to play with her today. Maybe we can come up with a cheer or something and then get Lily engaged. And then once she's really interested in the doll, then you can say, okay, Lily, now it's your turn. So,
okay, with your favorite doll, want to cheer for your favorite team? The Dodgers? Yeah? Want to say go Dodgers? Yeah? Want to do your turn? Come on, you do it.
I love your bear, Lily. Can you show it to us?
Say it was a gift from Dodger Stadium.
So cute.
Let's have the bear jump up and down.
Just jump.
Jump, jump. Yay!
So awesome. So it's see like how you kind of sat down in the sandbox and showed her what to do and then invited her over. And like by modeling that, it kind of gives her an idea of like the appropriate way to play with toys. And also she sees like you doing it and she sees that it's safe and that she kind of gets encouraged to do it with you. And that's like one way to get her to imitate you, which is super important for like other play. And so maybe we can try introducing another toy to her if you'd like.
This is her other little one. It's a smelly, like little stuffed animal.
Cute. And
put together with the cheerleader.
Oh, lots of them. They're gonna fly.
so
Jump together. Ready? 1, 2, 3, jump. Oh no, they all fell. They even have little blankets.
Cute. Nap time maybe?
Oh yes, we love nap time, right?
Yeah. The toy's getting tired. Lily, you're doing so good playing with the toys in the sandbox.
Hey, we get thumbs up. Yay, we get thumbs up.
So something else that you can do is like these are all toys that she loves a lot. So it makes her more inclined to like give in and come play with you. But to get her, you know, exploring more with other things other than just, you know, her preferred toys, you could maybe introduce a preferred toy and then bring in a non-preferred toy and kind of go back and forth. And that's how you could kind of get her to branch out with playing up with other toys and maybe other items at the park and stuff like that.
Okay. Introducing like a swing or something.
Yeah. And like, you know, you could start off with the preferred toy and then go to the non-preferred activity and then kind of do a combination of both and see if that gets her to do more at the park and introduce things in that way. But yeah, that went really well. And I'm so happy that she was able to go in the sandbox with you today.
Yay, can I have a high five?
Good job, Lily.